Hi everyone, and I'm so honored to address you ahead of your walk to end Alzheimer's today. I also want to take a moment to thank you for the work that you are doing to raise awareness and to pursue a cure for this terrible disease. I can't stress enough how important your advocacy is towards our goal of finding a cure for Alzheimer's and dementia and improving the lives of those impacted. Alzheimer's is a deeply personal issue to me as well. Both of my parents struggled with Alzheimer's before they passed away. As their primary caregiver, I personally know the heartbreak Alzheimer's has on patients and their families, and I understand the barriers this disease creates for our medical professionals. Because of my personal experience, I've worked to make sure that funding for Alzheimer's research remains at proper levels. I've also made sure that resources are delivered to the National Institute of Health to enhance our understanding and treatment of Alzheimer's and related diseases. Over the past several years, we have had many successes to move our advocacy forward. The passage of the BOLD Act and its implementation at the CDC helped cement the foundation needed to combat Alzheimer's disease and expand our research operations. In May of this year, I introduced a pair of bills that would build on this important progress that has been made to prevent and effectively treat Alzheimer's disease. The National Alzheimer's Project Act Reauthorization Act would reauthorize the NAPA through 2035 and modernize the legislation to reflect strides that have been made to understand the disease, such as including a new focus on promoting healthy aging and reducing risk factors. The other bill is the Alzheimer's Accountability and Investment Act, which would continue through 2035, a requirement that the director of NIH submit an annual budget to Congress, estimating the funding necessary for NIH to fully implement NAPA research goals. I've also led an effort to establish an ambitious national goal to prevent Alzheimer's disease and related dementias, and to develop a plan to achieve this goal within the U.S. Department of Health and Human Services. Most recently, I joined Hoppy Kercheval and Dr. Ali Rezai, the director of the Rockefeller Neuroscience Institute, for a discussion on Alzheimer's disease and dementia. We were able to share details on our own experiences and discuss resources and other efforts that may be helpful to others going through similar circumstances. To all of you in Huntington Day, I encourage you to continue fighting the good fight. Thank you again for all that you do, and I hope that you have a great day.